Paracetamol is the most commonly used painkiller after you've had an operation in the UK. We give it to almost every patient unless there's a specific reason not to. But does it make a difference whether we give you it as a tablet or liquid to swallow, or whether we give you it in a drip? Shall we have a look? So I'm going to talk about this paper, which looked at comparing oral paracetamol versus IV paracetamol after an operation. And for those of you who don't know me, my name is Amy and I am an anaesthetics registrar. So this was published in 2020, so it's quite recent. And the authors performed a systematic review of the literature, and they were able to identify 14 studies that looked at what we call perioperative use of paracetamol. Now, perioperative refers to the use of paracetamol kind of all the way through the operative period. So some of these studies also looked at giving IV or oral paracetamol either before or during surgery, as well as how it was given afterward. And across these 14 studies, there were 1,695 patients who were included. Now, the design of this paper is a trial sequential analysis, which is a bit like a meta-analysis in that what the authors aimed to do was to combine the quantitative or numerical data from all of those 14 studies to give an overall comparison between oral and IV paracetamol. And then between those two groups of patients, they looked at the difference in pain scores that were reported at 0 to 2 hours after the operation, so straight after, then at different time points all the way through to more than 24 hours after the operation. And the results basically showed that there was no difference at all, regardless of which of those two routes that they used to give you the paracetamol. Now, this is interesting because from a common sense point of view, you might expect that the intravenous paracetamol might work a bit better because it tends to be faster acting and it's not reliant upon anything else in terms of absorption of the dose from your stomach. It is worth mentioning that the authors did do a power calculation and they worked out that in order to show that IV paracetamol was better than oral, you would need a much larger sample of almost 4,000 patients. But their overall conclusion was that you would need to do those larger studies in order to provide evidence to justify the additional expense, because it is considerably more expensive to give IV paracetamol than oral form, so either tablet or liquid. Anyway, as always, if you have some relevant experience to share in this area or you've got any questions or comments, feel free to leave them here.